Dear friends, as you know, the geriatric populations, their physiological pattern and their disease pattern is very different. So whatever you observe, that may not be same equal like other general populations like adult or pediatric group. The geriatric age group is very special, and your assessment has to be well equipped so that you can report as when it is required for the further consultation, so that you can prevent the further damage. To discuss this patient assessment, how to assess and how to report, when to report, to discuss all this issue, today we are having expert Professor Manju Chugani. Welcome you, ma'am. Professor Manju Chugani is Dean, School of Nursing Sciences and Allied Health from Jamia Hamdard Institutions. Ma'am, once again I welcome you. Today we'll discuss about the patient's assessment, particularly the geriatric populations, and we will also discuss how to report and when to report these things. Switch to you, ma'am.
Okay. Thank you, Viplav. It is very interesting that we deal with all age groups. As a geriatric care assistant, we are going to deal with the geriatric patient. As a nurse or as a healthcare assistant, we deal with all age groups. But the geriatric age group is a group patients or people. I would say more often people. They are not all patients and should not be considered as patients. They are having their normal physiology which has changed. That's all is the difference. So it is very important for us to know that what all things we have to observe in them and what is the peculiar or the unusual thing which is to be reported to the supervisor or to the doctor or to the next healthcare facility. And I would say that in geriatric care, why we are emphasizing so much on assessment, because most of the things, if we identify early, we will not land up into the complications, or person can remain in the community or at home setting or can remain as normal as possible without many interventions.
Yeah.
So
मैम, I think ये जो assessment component है वो सिर्फ हॉस्पिटल में ही जरूरी नहीं, मेरे ख्याल से घर में भी, अपनी मोहल्ले में भी ये अगर हम पहचान सकते हैं तो पड़ोस में बैठे हुए जो बाबा है, जो बुजुर्ग है, दादू है, उनको हम मदद कर सकते हैं. तो ये सिर्फ हॉस्पिटल सेटअप के लिए नहीं, रादर देन हमारा जो घर में और परिवार में भी इसका बहुत इम्पोर्टेंस है, क्योंकि हर घर में लगभग हमारा बुजुर्ग होते ही हैं.
और इसका जो बुजुर्ग लोगों का पॉपुलेशन है ये इतना बढ़ने वाला है, 2050 तक 22% population is going to be a geriatric population, where what you said will be more important that we identify there itself. Therefore, we will go through a presentation where I will show you that what all observations and assessments we have to do for geriatric patients or geriatric people, I would say, in fact. And we will cover in this the domains which are to be covered in assessment, and assessment of elderly parameters, patient observation, recording and reporting, and then we'll conclude. When we start, I want to say that geriatric assessment and reporting is a multidimensional and multidisciplinary assessment designed to evaluate an elder person's functional ability, physical health, cognition, mental health, and socio-environmental circumstances. It is not only that you are going to see the functions of the elderly, you also have to see how is his physical health. Is he very fragile or very thin, lean, or he is well built? Then cognition is another important thing, whether they are able to remember things, understand and recollect all those things. And mental health, many a times you must have seen that elderlies are living alone. अकेलापन के कारण they are having problems related to depression, mental health, depression and other problems. And socio-environmental circumstances also are very important. Are they going to meet their friends? Are they mingling up with the peers and sharing, talking, laughing? All that is there or not. And early detection of problems result in early intervention, which can prevent deterioration and improve quality of life. Because whatever is the stage of life, we need to remember that we have to improve the quality of life, whatever is the age. And that is very, very important. And nowadays, everyone wants to lead a very good quality of life. So why not these elderly people are going to have this life which is having a quality, and they enjoy that period also. You must have observed in other countries, in foreign countries, even at the age of 85, 90, they go for shopping. They have special chairs. Their buses are having low floor where they can get in through these chairs and all that. They are enjoying every phase or every sphere of their life. So why not provide this opportunity to our people also? Therefore, this assessment and reporting is very, very important. Occasionally, we see that the elderly patients are related to neglect or abuse by their caregivers, and certain injury patterns or patient behavior are particularly suggestive, including frequent bruising, especially in difficult to reach areas. You can see at the back there are marks, blue marks, grip bruises. Their younger ones have held them very tightly, bruises on the genitals, peculiar burns, and unexplained fearfulness of a caregiver in the patient. The assessment domains, as I said, first one is the functional ability, to see that whether they are able to do their daily living activities, and instrumental daily activities of daily living are assessed. What does we mean by the activities of daily living? These are the simple activities like eating, dressing, bathing, transferring from the bed to the chair, and using of the toilet, controlling bladder and bowel. And instrumental activities of daily living are that they are able to live independently and include preparing meals, doing housework, taking drugs, going on errands for small shoppings and all, managing finances, and using a telephone. Many people will be able to use the telephone. They can just receive it, but they cannot dial the number, they cannot call, just can receive. So we have to see how much they are able to do it independently. Then physical health is another important parameter. In this, we have to collect the history, and physical examination is to be done, which includes common problems like vision, whether they are able to see, they are able to hear you, incontinence, gait, and balance. When they stand from the chair or from the bed, are they able to balance themselves, or it is unstable? So physical health is to be seen from their history and also from the examination. Cognition and mental health, there are several validated, means pre-validated tools are available. One is mental status examination, and for depression, geriatric depression scale. And socio-environmental situation, the patient social interaction network available, social support resources, special needs, and the safety and convenience of the patient's environment are determined, often by a nurse or GCA. Such factors influence the treatment approach used. A checklist can be used to assess the home safety also.
Yeah. मैम, इन दिस केस जो अभी हम एसेस कर रहे हैं उसको हम पीछे की जो हमने किया है, चाहे वो सोशल कॉज हो या फिजिकल कॉज हो या कॉग्निटिव डोमेन हो, वो अगर हम पीछे से हमेशा कंपेयर करते हैं, जैसे पिछले हफ्ते हमने देखा था तो ऐसा था हाथ में, जैसे आपने बताया कि ब्रूज मार्क है, तो कई बार पिछले हफ्ता नहीं था लेकिन इस हफ्ते हमारा राइट हैंड में ऐसा ब्रूज मार्क है, या फिर बैक साइड में है, जो कि एक फिजिकल तो उसका क्या सिग्निफिकेंस रहते हैं टू फॉलो अप दिस प्रोसेस, बिकॉज इट इज नॉट ए वन डे प्रोसेस, दे नीड कांस्टेंट मॉनिटरिंग एंड कांस्टेंट असेसमेंट, तो उसका क्या अहमियत रहता है?
एक्चुअली इस केस में यू हैव टू मेक देम कॉन्फिडेंस, यू हैव टू डेवलप कॉन्फिडेंस, देन दीज पीपल विल कम आउट. आपको वो सब बता देंगे पूरा कि पिछले हफ्ते में ऐसे था, खाना भी ठीक से खा रहा था, पर मेरे को इस हफ्ते में ऐसा लगता है कि मैं खा भी नहीं पा रहा हूँ, मेरा वज़न भी कम हो रहा है, क्योंकि मुझे डर है. जो भी केयर गिवर्स हैं, दे आर अफ्रेड ऑफ देम एंड दे आर इल ट्रीटिंग, अब्यूज़. So because of that, they are not able to tell you initially, but if you develop confidence with them, they have confidence in you that you are there to help them, or you will help them to identify their problem and then also deal with that problem. If they know that only you are going to ask them the history and other things, but you are not going to help them, they will not tell you.
Yeah. So basically, जो good communication is the cornerstone of basically assessment process.
Assessment.
Until unless we have a good communication and establish a rapport with the patient,
Yes.
earning the confidence,
That's
then
right.
only things this assessment will be carried out.
That's
तो
right.
हमारा जितने भी स्टूडेंट है उनको जो एक क्रेडिट अर्न करना, मतलब हम जो एक विश्वास आप बनाते हैं पेशेंट के साथ, एक रेपो बनाते हैं, उसका एक बहुत ज़रूरी है असेसमेंट प्रोसेस में, चाहे वो सोशल प्रोसेस हो या फिजिकल प्रोसेस हो या व्हाट एवर अदर थिंग।
असेसमेंट में पहला बात ही ये है कि आपको तो उनको बताना है कि आप क्यों करने जा रहे हैं, और ये करने के बाद ही आप बता पाएंगे कि उनको वो बिल्कुल फिट है या थोड़ा असिस्टेंस का ज़रूरत है या डॉक्टर के पास जाना है। तो वो कॉन्फिडेंस बिल्ड करना सबसे पहला इम्पॉर्टेंट बात है। अगर उनको कॉन्फिडेंस नहीं है तो बड़े लोग आपको कुछ भी नहीं बता देंगे।
हाँ, क्योंकि वो उम्र में हमसे बहुत बड़े हैं, दे हैव मच मोर एक्सपीरियंस इन ऑल डोमेन ऑफ लाइफ।
So we have to collect the history from them about their sensory deficits, understanding of under-reporting, as you said just now. वो तब तक नहीं बताते, इसलिए under-reporting रहता है जब तक उनको confidence नहीं होता that you are going to help them. Then unusual manifestation of the disorder, जैसे बहुत ज़्यादा उनको थकान हो रही है, वेट लॉस हो रहा है, दे आर नॉट ट्राइंग टू लूज़ वेट बट फिर भी वेट लॉस हो रहा है, तो ये वाली चीज़ें हमको उनसे पूछना पड़ता है कि ऐसा तो नहीं हो रहा है। फंक्शनल डिक्लाइन एज द ओनली मैनिफेस्टेशन, डिसऑर्डर्स मैनिफेस्ट सोनली एज फंक्शनल डिक्लाइन बिकॉज एनी डिसऑर्डर you will find that functional capacity reduces even in children and in elderly. You can correlate, if you have worked for the small children, then you can also think similar kind of things for elderly also. I will give you example that if you ask them about the severe arthritis, they are having a pain but they may not report it, stiffness, pain. But if you ask the question in a changed manner that are you able to go for shopping? Why did you not go for shopping? Or how long you have been to that mall? How many days back you went? They will say months and months back I went, I am not going. Then they will say that because my knees are paining, it is stiff, I am not able to walk. So what I mean to say that you have to really put the question in a way, different way. But I want to know that is she having pain or is it a stiffness, but she is not ready to say because they have high threshold of bearing pain. So we need to frame the question in another form and ask them. And why we are doing all this is because we want to restore their function. Whatever is limits, we should not go below that. We should try to restore that function or to prevent further decline so that they can maintain their independence. Because independence is very, very important for them. Otherwise their self-esteem will go down.
Yeah. Dignity
because dignity, self-esteem, it is equally important. They do not like that they are dependent on you.
Yeah.
So we need to see that they are independent, and for that we have to prevent or restore their abilities which they have. And then they have
I think मैम वो जो खाने का हैबिट में भी सेम थिंग है कि आपने बहुत सारे लोग इसलिए नहीं खाते कि उनको कॉन्स्टिपेशन हो जाएगा पर्टिकुलर चीज, तो दो खाने के मामलों में भी वो उनका कोई लोगों को पाइल्स होता है या फिर पानी इसलिए नहीं पीता क्योंकि इनकॉन्टिनेंस होता है, सो उनका प्रोस्टेट का भी प्रॉब्लम रहता है. सो आई थिंक इट इज आल्सो कोरिलेटिंग द सेम वे थ्रू इनडायरेक्ट क्वेश्चंस वी कैन असेस इट.
Yeah, that's right. And the age-related disorders, as you said, constipation, depression, these things we need to find out. Also their fears. When did you go to the hospital when you had that problem? So help them to recall. And the objectives of this assessment which we are doing is that we want to prevent the decline in their deficits or their problems. We want to reach to some diagnosis, screen them for preventable diseases, and find out their functional impairment, improve the diagnosis, and also we would like to recommend optimal living environment, monitor their clinical changes over time, and predict outcomes. For geriatric assessment instrument is there. For daily functional ability, what you can check is the degree of difficulty in eating, dressing, bathing, transferring, using toilet and controlling bladder and bowel, and degree of difficulty in preparing meals, doing housework, taking drugs, going on errands, managing finances and using the telephone. And assistive devices are like, for example, use of personal devices, cane, walker, wheelchair, they find it difficult or can they use it easily. Use of environmental devices, like nowadays we recommend that grab, the side rails should be there in all staircases, and in hospital the bed should also have side rail, and so that it should go down with the button, and then they find it easy to get in the bed. Caregivers, use of paid or unpaid caregivers. Who are the caregivers? What are the drugs they are taking, prescribed drugs or non-prescription drugs? Because many of them are taking Ayurveda or some other pathies which are not written, or they do not even have slips or
उनका
the
दोस्त खा रहा है
prescription.
जिससे उनको बेनिफिट मिल
वो
गया
भी-
तो
वो भी पता
वही खा
करना
रहा
है
है
हमको, हाँ।
तो वो सब तो बहुत कॉमन
पूछना
है
है हमको।
बिकॉज द कॉन्फिडेंस वो अर्न कर लेता है एक ही साथ में, वो चाहे मॉर्निंग वॉक करे या शाम को एक साथ चाय पे बैठे, वो कह रहा है कि अरे मेरे चाचा का लड़का तो उसी को खा
उसी
के
दवाई से
हुआ।
ठीक हुआ।
तो वो भी बोलते हैं खिलाओ, मैं भी खा लेता
भी,
हूँ।
हाँ,
तो उस टाइप का जो
बिल्कुल।
बहुत ज्यादा प्रैक्टिस पर्टिकुलरली हमारी कंट्री में है, सो
हाँ।
ये सब तो हमको पता करना है।
हाँ, ये पूछना है सब। न्यूट्रिशन एक बहुत इंपॉर्टेंट बात है, उनका हाइट वेट से भी आइडिया होगा आप क्या ठीक खा रहे नहीं। और एक और बात, उनको आप पूछ सकते हैं कि पिछले 6 महीने में आपका 4-4.5 किलो से कम तो नहीं हो गया वेट? अगर बिना कोई कारण वही खाना खा रहे हैं, वही एक्टिविटीज़ कर रहे हैं और अपना मर्जी से कम नहीं कर रहे, अगर कम हो रहा है तब आपको ज़रूर आगे रिपोर्ट करना है। ये जो रिकॉर्डिंग था उसमें रिकॉर्ड करना है इस बात को। और प्रिवेंटिव मेजर्स ज़रूर लेना है। रेगुलरली आपको बीपी चेक कराना है उनका। और स्टूल में कई बार होता है, ओल्ड जेरियाट्रिक पेशेंट्स और जेरियाट्रिक पॉपुलेशन वी फाइंड दे हैव कॉन्स्टिपेशन, बिकॉज ऑफ दैट दे पुट प्रेशर, फिर ब्लड आने लगता है उसमें स्टूल में। सो वो एक पूछना बहुत इंपॉर्टेंट होता है। और टाइम टू टाइम, जैसे इन्फ्लुएंजा शुरू हुआ, वैक्सीन लगा लेने से उनको प्रिवेंशन होगा वो सबसे। थायराइड स्टिमुलेटिंग हार्मोन एक इम्पॉर्टेंट चीज़ है जो पता करना चाहिए। एंड इनटेक ऑफ कैल्शियम, विटामिन डी एंड एक्सरसाइजेस, दीज आर वेरी वेरी इंपॉर्टेंट फॉर देम। एंड आप उनका कॉग्निशन देखने के लिए पूछ सकते हैं 5 चीज़ें बताइए, सेब, केला, अमरूद, अंगूर, नाशपाती। फिर उनको वापस पूछिए, अगर वो 3 आपको वापस बता पा रहे हैं, कॉग्निशन इज ठीक ठाक है उनका, ठीक है इसका मतलब। देन also you have to find out affect feelings, very important, that depression, sadness, lack of interest, pleasure in doing things, and possession of a living will, establishment of durable power of attorney, their will and all papers, are they taking interest in that or not, are they using some abuse, substance abuse. Okay, gait and balance is also to be seen, because fall is another problem, very important and very big problem. If they land up into that, if they fall, osteoporosis is there, their bones get fractured, and if bones get fractured, it is difficult
invites
to get
more problems.
invite more problems. And you also have to see their sensory ability, that whether they are able to remember the numbers or not. Upper extremities, you have to see whether they are able to hold it or not, clasp the thing.
I think, ma'am, these sessions will stop here.
Okay.
And in these sessions we have discussed about this reporting component, particularly the geriatric assessment. Geriatric populations, they are not all patients, as you said. We have discussed about this, how to assess the different components, particularly social, physical and cognitive domain. And there we are in the process of discussing this scale, what are the different components of the scale and how to approach them. And here we will stop today. And I here would like to say thanks to Professor Manju Chugani, as well as thanks to our EMPC team who is helping us to broadcast it. And I would like to say thanks to all of you.
Thank you.